Goeienaand, good evening, fellow South Africans and citizens of the world. And we had a ripper of a live stream earlier this evening with Mariandra Hirnis, and what an amazing woman she is. Absolutely amazing. I can say no more than that. Now, let's get back to what's happening in South Africa right now. Well, first of all, this is the idiocy of people in the black townships, where they're just completely ignoring social distances and making sure that no one can infect you. And the main reason it's turning out is because the Sangomas have told them that this coronavirus is a white man's disease. Only the white man will get it, the black man won't get it. So that's why you've had these groups of blacks, which we've seen in the last couple of weeks, singing that song, Corona, Corona, Corona. We've even seen a black woman licking a shopping trolley handle, saying, I want to get the Corona. I mean, they're absolutely idiotic. It's the L factor, missing in action. Well, I'm going to play you a short video where you can see firsthand what the attitude in the townships is towards the coronavirus. Let's watch that first.
Okay, wait. Say again, Corona does what?
There is no Corona here.
And what about black people?
We are black people. Corona won't kill us.
You won't kill us?
It's not going to kill you.
Only white people?
Yeah.
Why do you say so?
Because you are the ones that coming from across the seas.
Okay.
You came with Corona. Corona is across the
So
seas.
no black people will die from Corona?
Never.
Sure.
Ask Ramaphosa.
Ramaphosa won't die?
Okay, from the horse's mouth, what can I say? Now, the incredible, how can I put it? The incredible coincidence is that at the same time as this guy is saying the black population can't get the coronavirus, it's a white man's disease or virus, Khayelitsha has become the first township in the Western Cape to confirm a COVID-19 infection. Now, Khayelitsha is a township which is huge, and this is very disturbing because among the people that live in there, and I'm sure there are over 1 million people living in that township, it is just a huge area. Consider what the spread of this virus is going to do through that community. It's going to devastate it. Think of the people who got HIV/AIDS or TB or something that hits their immune system. You know, this is a huge tragedy, and the public hospital system is just complete chaos. So, you know, South Africa has become a third world country, to be quite frank. Getting back to the situation here with Khayelitsha, the Western Cape is currently dealing with 310 coronavirus cases. South Africa's only COVID-19 related death was recorded in Cape Town on Friday. Now, I'm hearing that there have been others, but they've been covered up by the ANC government, which would not surprise me. But that's unsubstantiated. South Africa is worried about the coronavirus hitting its townships. Western Cape Premier Alan Wind has now confirmed a person has tested positive for the virus in Cape Town's largest township, Khayelitsha. Now, what I'm going to be talking about after this little piece is why they should be very, very concerned in Cape Town or in the townships. Thousands of families live in very close proximity to one another in the township, and some households have as much as 7 to 10 people living together, making social distancing very difficult. Water and sanitation is also a major problem, with many houses that still don't have access, and one block of communal toilets are shared between hundreds of residents. Think of that. You put your hand on the lever, or you put your hand on the seat, when you got the virus, next person comes along, bang, guess what? They got the virus. It's crazy. Meanwhile, in the neighborhood community of Mitchell's Plain, 5 people have tested positive of COVID-19. Now, this is where it gets scary, because we're talking about those that have actually been shown to be positive. Okay, let's hear about what's actually going on behind the scenes, because this is absolutely shocking. Since last week, Health Minister Zweli Mkhize has been talking about how the country will ramp up testing for COVID-19, yet laboratories have a backlog of more than 5,000 tests. Now, I'm getting information that it's taking those laboratories up to 9 days to process a test. 9 days. Imagine how that coronavirus could have just spread through the community hugely in that period of time. Anyway, continuing. The impact of this has been confirmed by doctors in the private and public sector who have told the Mail and Guardian that there is quite a backlog in getting results for COVID-19 tests. Between February the 10th and Tuesday this week, more than 15,000 tests were conducted, with 3% of those tests confirmed as infected with COVID-19. One of the doctors in the public sector with whom the M&G spoke said the backlogs were due to the sector as a whole being unprepared for the virus. The ANC government, they're incapable of doing anything, quite honestly. The doctor said, currently we are only confirming cases of those who show symptoms and the rest have to wait. This is the backlog. This is absurd as the virus incubates, giving it time to spread. We can't quarantine people who have not yet been confirmed because the tests are not available, and that's because they are not showing symptoms. The Department of Health spokesperson, Papa Maja, did not respond to questions about the backlog. Isn't that typical? In the last few weeks, the department has taken to not answering questions, saying rather than that it will address issues in press briefings. Now, the reason it's doing that is because they have been told that the ANC government want to control what you hear regarding the coronavirus. And that puts me in a very strong position. I do not live in South Africa. If you have some information, if you have a video, if you have images, links, whatever it is, please email them to me, because I will report them. I will cover them. Where the mainstream media in South Africa and all the YouTubers in South Africa have been hamstrung, because if they report on this sort of stuff, guess who's going to come knocking at the door? The thought police. So that's what makes this channel different, guys. You can send me that info and I will cover it. If it's unsubstantiated, I will say this is unsubstantiated, but I will cover it. Dr. Atiya Mossam, a public health medicine specialist, said that if we are not getting test results on time, we won't know how many people are truly infected. This also means that the numbers given each day are results from the day before, and not the number of infected people or even the number of people who might have tests that will show that they are infected. Mossam said, remember a few days ago when numbers shot up by more than 100 cases, that was from the backlog and not the tests that had been conducted that day. He said, if we are not testing enough, we are not picking up the cases. This, she said, could mean that the government will end up working with a skewed picture of things as it uses a 21-day lockdown to see how COVID-19 has spread. Very, very good point. Especially when you're in the townships, they're completely disregarding self-isolating. In many cases they can't, because you've got multiple families living in one shack. What do you do in that situation? It's crazy. With the disease taking up to 2 weeks to burn out of people who don't end up hospitalized, the government would expect over 700 people who have currently tested positive to either be in hospital or better before the end of the lockdown. Now, obviously, this figure is out of date. It's well over 1,000 people in South Africa that have tested positive for the coronavirus now. Mossam said this might make it look like numbers have stabilized, but we will still be sitting with a backlog of tests. The private sector is also battling. Professor Eftia Vardas, a virologist from Lancet Laboratories, told the M&G that since March the 16th, they have received more than 16,000 swabs and have tested more than 9,000. This is 3 times the volumes that other private labs have received or tested, according to Vardis. The impact of COVID-19 in other countries is also a problem. Testing reagents, the chemicals used to complete the tests, are in short supply everywhere, with countries all trying to get tests. This has been compounded by cancelled international flights. Vardis said that with these problems, as well as the number of people asking for tests who did not meet the requirements set out by the NICD, or National Institute for Communicable Diseases, it has left us with this problem of low test availability resulting in delayed turnaround times. We regret this deeply and have tried wherever possible to prioritize tests for high-risk individuals, those that are hospitalized and healthcare workers, said Vardis. A private laboratory doctor confirmed this, saying that the backlog was growing. The backlog is mostly due to people who are panicking and want to be tested for no reason. This panic testing will put pressure on an already strained system. South Africa is not the only country battling with this. Earlier this month, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, said the only way to curb the pandemic was through mass testing. We have a simple message for all countries: test, test, test. Trying to ramp up the testing has put pressure on rich, poor and middle-class income countries. Media in Canada reported on Wednesday that the country was also experiencing backlogs because of short supply of important testing chemicals. We all would want more tests, Canada's Chief Public Officer, Dr. Theresa Tam, was quoted saying. Nearly 120,000 Canadians have been tested for the novel coronavirus, an average of 10,000 a day. There are many other countries that are facing the serious hurdle in their bid to flatten the pandemic's curve, including the United States of America and Ireland. In a letter dated the 20th of March, the National Pathology Group, comprising the 3 biggest private laboratories, Lancet, Ampath and Pathcare, told its members that requests for COVID-19 testing were placing extreme pressure on member laboratories' resources. The letter read, "Worldwide demand has created bottlenecks in the supply of N95 and surgical masks, nasopharyngeal swabs, gloves and COVID-19 testing kits. Our laboratories are struggling to meet demand and turnaround times due to the inconsistency in supply of materials required to produce reliable results." The letter went on to request that laboratories should adhere strictly to the NICD guidelines on making test requests. Testing asymptomatic people is a waste of scarce resources, and that there could be a failure to meet turnaround targets to publish test results. They said, "We are prioritizing testing for in-hospital patients, high-risk groups, index cases in community centers such as schools and old age homes." Meanwhile, the National Health Laboratory Service, or NHLS, said that they would be ramping up testing and that by the end of April, South Africa will be able to process approximately 36,000 tests a day. The United Kingdom, which has close to 10,000 infected people and seen more than 400 deaths, will be ramping up its testing to about 10,000 people a day, according to their Prime Minister Boris Johnson. More testing has been shown to slow down the infection rate as countries are able to isolate the sick and curb infections. Countries such as Singapore, Australia and South Korea took the decision to test aggressively and widely at an early stage, and this has for now slowed down their infection rates. NHLS spokesperson Imzi Gukumana said that the organization had adequate testing capacity and equipment to meet the demand. He added that the suppliers have made a commitment that South Africa will be a priority. The country's laboratory services have 6 laboratories performing COVID-19 related tests, with 18 state-of-the-art Cobas 6800 and 8800 machines for processing samples, and 180 gene expert analyzers, which Gukumana said would be available in all provinces for testing by April. He said, "These are the machines that can process tests in 45 minutes, and the smaller machines can be placed in mobile vehicles, which makes it ideal for community testing." So there you go, guys. The actual results of testing in South Africa at the moment are probably about a week late, because of the slow process of the testing kits. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.